Hey everyone, welcome back to my vlog channel. I know it has been quite a while since I uploaded a video here, and ironically this video ties in with my long video, which was about changes that were coming in May 11th, about people being removed from Medicaid eligibility, etc., and everything that tied in with that. Well, this video is about me and what happened recently, where I, along with Lord knows how many other people here in South Carolina, sort of got caught up in the crosshairs and were receiving letters that we were being removed June 1st from Medicaid because we were not fully eligible for it. So this actually started, I want to say, mid-April. I received a letter about my upcoming renewal. And while I was waiting for the form, I got a second letter, which stated that they used my info from last year. I didn't have to fill out the form, disregard it when I got it. Okay. So by the end of April, I received the form, but again, a letter attached with it saying I didn't need to fill it out, that they had used my info from previous year. Okay, fine. Beginning of the second week of May, I received this letter that June 1st I was going to be ineligible. Now my friend had received that letter too. So I double-checked before I appealed this. I double-checked to be sure, that I am eligible for it. So I went on the Social Security website. I also Googled and checked out a couple of different sites and got the same information, that if you are on SSI in South Carolina, you are eligible for the Social Security Medicaid, especially if you're not age eligible for Medicare. Okay, that's all I needed to verify several times, so I didn't look like a fool appealing. So I went and appealed this. About a week later, I went through electronic communication, obviously faster. About a week after I filed an appeal, I received a notification that it was received. And then a few days after that, I received like a mass mailing. A form letter that was sent to me and a whole bunch of other people with this particular lady's name on it. And the reason I know it was sent to other people is because they mistakenly had all their email addresses, including mine, attached to this letter, which was wrong. I am sure that violated some sort of privacy thing. I don't even know what, but I'm pretty sure that was wrong to do. So I basically got that. Then, while that was going on, I had several appointments, and I didn't want to cancel them. My heart doctor gets a little uppity if you have to cancel and reschedule. Understandable, but still, I didn't know really what to do. Well, I went to my heart doctor appointment. That was fine. Went to my therapist. But when I went for my mammogram, that's where they told me in the system I was inactive. And this was right at the very end of May. So I called Healthy Connections up, I called First Choice up, and they're insisting that this was a mistake and that I am active in their system. Well, that afternoon I tried to pick up some of my scripts from the pharmacy, and they were going to charge me like $30 for 2 scripts. And I said, so no, it's not coming up in the system for everyone, and if I'm eligible, then this needs to be fixed. I mean, I can't do anything on my end. I'm going by what you all are telling me, but it's not showing up on other people's ends. So I had to essentially call Healthy Connections back. They had to do something with an email on their end. And I had to call First Choice. And First Choice had to do something with different departments on their end. And then I had to call back one more time to double check that everything was the same in anybody's system. Then I was able to go pick my scripts up like normal. So thankfully it didn't take too much to straighten out. I did receive a letter that it was administrative error and that I never lapsed coverage. Well, I don't know about that, considering I came up in a few different systems as inactive, so I don't know about all that. But anywho, it seems to have been straightened out with minimal damage. But just seeing, so many people this is affecting all around the country, it stands to reason that there needs to be some sort of basic health insurance for people. Now, I'm not talking Medicaid. I'm talking something simple, something basic that at least they would be covered. If they got sick, they could go to a clinic. If they needed a prescription after having gone to said clinic, they could get some of it paid for. But there needs to be something. I mean, like Pennsylvania, for example, Ronnie would have been able for at least a few months to have had Medicaid. Down here, single people can't get it unless they have substance abuse issues, intense psychiatric issues, alcohol issues, and it's just ridiculous. It really, truly is ridiculous. Now, I've been told that at one time single people could get it, and I guess budget-wise they eliminated it. But if you think about what it's going to cost them long run, when people with no insurance get deathly ill, wind up in the hospital, maybe have to get surgery, etc., and they got to pay for all that, versus paying for someone to be able to go to a doctor and get medication or, get a problem treated then, versus having to wait till they wind up, in critical care in the hospital. Makes no logic and no sense. But then again, nothing with governments really makes much sense anymore either. But, like same with the whole, food stamp thing too, with the cost of living adjustment. I'll never understand how it's legal to have the federal government give you something and then other federal programs can take that from you. No, there should be a cap with that. I don't know if this is true, but somebody that I met at the food pantry told me this about a month ago, that in Florida, for food stamps and for housing, that they do not count if you're on SSI or Social Security. And I thought, well, how do they charge you rent then? If you're on a fixed income like that, like how do they base your rent on if they don't count that as income? That I didn't quite understand. But she said they don't count that as income for food stamps. And so you wind up getting more food stamps down there, I guess, versus, other states. I don't know. So any of my subs from Florida, please elaborate on that or dispute that. I don't know. I'm only going by what someone that was at the food pantry told me. And I gather she had lived in Florida several years ago when her children were smaller, so I don't know. But that kind of puzzled me because I thought, well, as far as your rent, what do they base your rent on? If they don't count that as income. That kind of left me a little confused. But yeah, this is really a bind. Now, Ronnie did try to get something through the Affordable Care Marketplace, but all these plans cost several $100s. Now, there's supposed to be some sort of subsidies that'll help pay for that, but none of these plans ever tell you how you go about applying for that to get help to pay for that insurance. So, if somebody has any answers about that, please let me know in the comment section, because I'll be damned if anybody has reached out to my son and said, well, here's how you apply to get this paid for. No, they just want to shove you into a plan. And no, because you have told them, okay, I can't pay this. I'm not working. I can't pay this right now, whatever. And so, yeah, it's really, really bizarre. Very bizarre. I would really love to work on soon for this vlog channel. A video about this misconception going on right now here in the U.S. Everybody is hiring. Everybody is hiring. Yeah, how many people, I see it on TikTok, I've read it online, are putting out applications, resumes, having interviews, and they're not getting hired. So what is going on, and what are some of the possible reasons of why people are not getting hired if everybody is hiring? And I think I'm going to start working on that type of video for this vlog channel, because it's pretty interesting, some of the reasons why places may be saying they're hiring, but not necessarily hiring, if you can read between the lines. Anywho, guys, I just wanted to share my experience, which wasn't that bad, thankfully, with this Medicaid issue. And let me know in the comments section if you had something like this happen to you or someone you know, and how long did it take to straighten it out. Well, thanks for watching, everyone. Take care, and I will be seeing you all soon on my next one. Bye.